However, just like the virtual supermarket, it goes to our homes, we get the food and it goes to our homes, and that's where education about health, cardiovascular and heart health starts, and it starts at home. We as individuals must also try to do our part by taking better care of ourselves. I know that, I don't know about you, but I'm doing my best to extend my, I used to call them my January resolutions instead of my New Year's resolutions because they didn't seem to go past January. But all of us make the resolutions to be more healthy, but we have to really mean it. And I'm glad that we're in Heart Health Month, Heart Awareness Month, that we are doing our part to renew our commitment to take care of ourselves. There are simple things we can do to make our heart stronger. We can get educated about the risk factors of heart disease. We can cut our salt intake, and I feel the glares of one of my people I work with who tries to keep the salt shaker away from me every time she's with me. So I know that I need to do more in cutting my salt intake. Make healthy heart choices. Make healthy, food choices, so we can do more to limit the amount of saturated fat that we have in our diet, salt that we have in our diets, things that really impact the health of our heart. And we can also exercise regularly. As well, we can quit smoking and schedule regular blood pressure and cholesterol screenings. Let's make it our mission and work together to save lives in Baltimore and make a difference. I want to thank our community partners for all of their help in bringing this issue, make it easier for us to bring education to the community. So I'd like to thank St. Agnes Hospital and the American Heart Association's Mid-Atlantic chapter. I want to thank Care First Blue Cross Blue Shield, the Heart Truth, United Healthcare, and United Healthcare for their support of this very important work. Through successful campaigns like Go Red, we are raising awareness about heart disease among women and their families. And finally, I want to encourage all city residents to join me and wear red, even though it pains me to wear this intense pink that some of us call red in this month. It's important for all of us to wear red in support of Heart Awareness Month. And this Friday, February 4th, when we celebrate National Wear Red Day, I want you to wear your red to increase awareness about heart disease among women. And on Sunday, February 13th, in observance of Red Dress Sunday, an annual citywide initiative to educate minority women about this #1 killer is made possible by St. Agnes Hospital. And again, I encourage everyone to wear red on that Sunday as well. Let's work together. Let's prevent deaths where we can. Let's make an impact. Let's make our city safer, and let's make a difference in the fight against this silent killer. Thank you very much.
Thank you, Madam Mayor. Thank you. A lot this week. Last week, the American Heart Association report indicated that the cost of heart disease in the United States will triple between now and 2030 to more than $800 billion. Monday, the U.S. Department of Agriculture released its 2010 dietary guidelines for Americans, and within that report made some very specific recommendations about reducing salt intake, reducing cholesterol intake, very detailed recommendations about how individuals could be more informed about making healthier choices in their diets. Yesterday, there was a new CDC report that 2 out of 3 U.S. adults with high cholesterol and half of U.S. adults with high blood pressure are not being treated effectively. Again, these are areas where we can make a big difference. And so what I take away from these reports is that despite our best efforts, the message isn't getting out there. And despite the fact that we've made some inroads, there's still a lot of work that's yet to be done. And so we need to be smarter and targeted and focused about our education. And I want to share with you just 3 brief examples of what the health department is doing in this area. So our CHAMP program is a partnership with churches to educate women about cardiovascular risk factors. Our barbershop initiative is an initiative that we have where we educate men on their risks for heart disease, and thus far we've screened over 2,500 men in this city. And then lastly, as one of the examples, is the next phase of our Healthy Birth Outcomes initiative, where the tagline is, healthy moms have healthy babies. And what this is helping women make the connections that in order to have healthy pregnancies and healthy babies, we need to have healthy weights. And so we invite you to partner with us in these initiatives. We expect other initiatives that we're working on to also improve cardiovascular health, and those are the indoor smoking ban and the work that we're doing to reduce trans fat in restaurant establishments. And we can do more. And so Baltimore is a partner in the National Salt Reduction Initiative. And as I mentioned earlier, the federal government came out recently with recommendations about reducing salt intake. And it's especially important for individuals in the African American community and those with hypertension, diabetes, and other illnesses that put them at greater risk for cardiovascular heart disease, to really take heed of these important messages about the importance of reducing salt in their daily diet. And it's not only about the salt that we use at the table, but it's the choices that we make when we go to the supermarket, and the importance of reading labels and paying attention to the sodium content. And so finally, we must continue to build new partnerships and hold ourselves accountable to help each other do better, and ultimately increase the health of the city and reduce cardiovascular mortality. And so now I'd like to introduce Crystal Herring, Senior Director of Corporate Relations at the American Heart Association Mid-Atlantic Affiliate, to tell us more about the National Wear Day and Macy's Go Red for Women Health Fair and Fashion Show. Thank you.
National Wear Red Day. So we invite all of you around the city of Baltimore to join America as we wear red to really, really promote awareness against cardiovascular disease among women. As you've heard already today, 1 out of every 3 women dies of cardiovascular disease. It is our #1 threat to our health and our wellness. And we want to make sure that our city is leading the way with really creating the awareness, but also creating the solution so that we can see that disease eradicated over time. And Mayor Rawlings-Blake with this official red dress pin from Swarovski with the beautiful crystals and rhinestones. Just again, wear red. We want to bring her red dress, an intense pink dress, all month of February. Thank you all.
Good morning. I just want to reiterate what the commissioner and the mayor said about heart disease, and something that we can all do is to reduce our salt intake until we eventually can eliminate it. And we exercise. We can start by exercising 10 to 15 minutes a day. Here in City Hall, we could use the steps instead of the elevators, and we could do more walking. So 2 simple things we can do is to reduce our salt intake until we can eliminate it, and to exercise more. Thank you.
Shade of red is a little bit deeper. Maybe that pleases the mayor, but I said my shade of red, like my shirt is a little bit deeper. I didn't realize it needed to be a shocking pink, but I embrace any opportunity to go shopping. Again, my name is Sharice DeLever. I'm the co-chair of the 7th Annual Red Dress Sunday Committee at St. Agnes Hospital. On behalf of St. Agnes, we are honored and proud to partner with the city, our sponsoring church, Mount Pleasant Church and Ministries, Care First Blue Cross Blue Shield, United Health, the National Heart, Lung, and Blood Institute, the Heart Truth, and others for an event that has touched, inspired, and impacted so many lives. For nearly 150 years, St. Agnes has been dedicated to the art of healing by providing exceptional care to the greater Baltimore area. St. Agnes has a strong commitment to community service, prevention, and education, and we are honored to stand hand in hand and partner with the city and the community we serve daily to endorse this important event. As said before, on February 13th, thousands of women will celebrate by wearing red to church in honor of Red Dress Sunday. In 2003, St. Agnes Hospital created Red Dress Sunday, which is held annually on the Sunday before Valentine's Day as a way to recognize Heart Month and raise awareness among women about the dangers of heart disease. Since that time, it has grown immensely and become so much more. It's truly inspiring to see thousands of women and men united in red to promote heart health. What started as a few churches participating has grown into a record 132 churches across the region involved in this year's event. What started as speakers and survivors telling their stories of hope has grown into more than 100,000 women being educated about heart disease through materials, on-site blood pressure screenings, and health fairs. But while this is a great accomplishment, our journey is far from over. Each year, the reach of Red Dress Sunday continues to grow. Each year, our volunteer base expands. Each year, we have partners who are more generous with their donations than the year before. And as we move forward, it is our hope that Red Dress Sunday will continue to touch women across the nation. That being said, I'll see you on February 13th, and I'll be the one in the red dress. Thank you.